Welcome everybody to tonight's webinar. I really want to spend time tonight and really talk to you about what I call true preventive medicine. And I'm going to teach you tonight just the basic understanding of oxidative stress. We're going to learn a little bit how you can best prevent these chronic degenerative diseases we'd all love to avoid. And then what providing cellular nutrition really means and how the Ariix optimals are the absolute best way you can accomplish this goal. You need to understand that even though oxygen is necessary for life itself, it's also inherently dangerous for our existence. You know, what happens is when we utilize oxygen within the furnace or the battery of the cell, which is called the mitochondria, occasionally there's a charged oxygen molecule that is created, and we call this a free radical. A free radical actually has at least one unpaired electron in its outer orbit, which gives it very rapid movement. And this is something that you have to understand, that it can go on to damage the cell wall, the vessel wall, proteins, fats, even the DNA nucleus of the cell. But the number of free radicals you and I produce each and every day is not steady. In other words, there are situations where we actually have to handle more free radicals than at other times. People that are on medications, especially potent drugs like the chemotherapeutic drugs, even sunlight can increase oxidative stress or free radicals. The pollutants in the air, food, and water can increase the number of free radicals you and I have to handle. Cigarette smoke is one of the greatest causes of increased free radical production, and even secondary smoke. That's why you see all these studies coming out of the damage that can occur just with even secondary smoke. Radiation. Excessive stress is a big thing. You see, when you have mild to moderate stress, the number of free radicals you produce goes up just a little bit. But if you're under chronic or severe stress, they go up exponentially or off the graph. This is really key to understand. So the numbers of free radicals you and I produce is not steady. But here's the key thing you have to understand. The medical literature shows us beyond a shadow of a doubt that oxidative stress, this free radical damage, is the root cause of more than 100 chronic degenerative diseases. Now, these are the who's of diseases. This is heart disease, cancer, diabetes, Alzheimer's, dementia, arthritis, macular degeneration, lupus, MS, stroke, Parkinson's disease, and the list just goes on and on. So we are talking about the very root cause of disease. Now, this free radical damage will cause the body to have an inflammatory response. So many of you heard or have heard in the media that it's inflammation that causes a problem, but really it's free radical damage that actually sets off the inflammation. So the actual base cause is free radicals. So just to make it simple, we are basically rusting inside. So the same process that causes a cut apple to turn brown or rust metal is literally rusting us inside. And this is what I found in my research, that this generation, you and I, we have to handle more free radicals than any previous generation that has lived on the face of the earth. You know, so I always ask you, are you winning the war within that's being battled within every cell of our body? Or are you coming into my office rusting from the inside out? You see, the car on the right is how a lot of patients come into my practice. They're all rusted out. They're saying, "Doctor, save me." And we pull out our big guns of medication and aggressive surgery and everything that we do to try to change this. But I believe that we need to think about what is the antidote. We are not defenseless against this process. You see, antioxidants actually have the ability to render those free radicals harmless by giving them the free radical or the electron that they're desiring to neutralize those free radicals. So your antioxidant defense system can actually protect your body, just like a fresh coat of paint protects your car. You see, balance is the key. This is what I've learned in nutritional medicine, is you need to have more antioxidants available than the free radicals you're producing. See, antioxidants actually allow you to prevent oxidative stress. And so this is a principle you have to understand. So when I researched the medical literature, I spent probably 5 years researching the medical literature in regards to oxidative stress, free radical damage, before I wrote my book, What Your Doctor Doesn't Know About Nutritional Medicine. But the main reason I was looking at it is because for 23 years of my medical practice, I had been telling my patients they did not need to take supplements. All they needed to do was eat a healthy diet. And this is what I had told them. So I was trying to really look at the medical evidence and come up with a verdict. Should my patients be taking nutritional supplements? And I'm just sharing with you my conclusions. I concluded after all this research that our bodies are actually our best defense against developing any of these chronic degenerative diseases, and not the drugs I could prescribe. You see, we can't trade in our body. Our body's aging, it's rusting. So we need to learn how to best protect our health. There are patients who come in like this Model T that come in, they're in their 80s or 70s, and they're vibrant, they're healthy, they're alert, they have excellent health. And then again, so many of us are really suffering and dying too long because we're suffering from rheumatoid arthritis or some degenerative disease like Alzheimer's dementia. So what I learned is if you want to give yourself the absolute best chance of avoiding these chronic degenerative diseases, you need to be taking nutritional supplements. So let's just talk about what my patients are concerned with. My patients now come in and they say, Dr. Strand, I'm not as concerned anymore about the number of years of my life as I am the quality of life in those years. This is what I'm hearing in my practice. Well, when you look at it, you know, you really try to go ahead and say, what good does it do you to live to a ripe old age of 93 or 94 like President Ronald Reagan, when he suffered from Alzheimer's dementia and hadn't recognized his spouse or his family members for over 10 years? What good does it do you to live like Muhammad Ali, to be the greatest athlete probably to ever live? And I don't know if you've seen him lately, but to suffer from Parkinson's disease, it's not a very exciting life. And you look at it and you know that Muhammad Ali and Michael J. Fox and these people, they can afford modern medicine. They can do it, but the trouble is by the time we diagnose Parkinson's disease, 80% of the brain cells involved in that part of the brain have already been destroyed the day we diagnose them. So what we need to understand is that our bodies are our best protection. So when I've studied the medical literature, what I have learned is that we do our research by, we'll study vitamin E and find a tremendous health benefit by taking vitamin E at an optimal or advanced level, not RDA. You might see another study with vitamin C showing a tremendous health benefit. Maybe selenium, magnesium, calcium. Now we're seeing all kinds of studies on vitamin D, beta-carotene, even building up your glutathione antioxidants. But what happens is that I've learned that vitamin E is not a drug. It's just a nutrient we get from our foods. But now that we can supplement our diet, you can get them at levels you can't obtain from your foods. And so what I'm learning is that if my patients take cellular nutrition, and I define that by providing all the nutrients to the cell at these optimal or advanced levels that have been shown to provide a health benefit in our medical literature, and not RDA levels, and I'll get into that here in just a minute, that you can build up the body's natural defenses. In fact, cellular nutrition is really about health. It is not about disease. So what I have learned, when I started my medical practice in the early 1970s, I was convinced that people needed to exercise. I was a great fan of Dr. Kenneth Cooper, who actually coined the term aerobics, and I I really promoted my patients needed a consistent exercise program. And I also knew there was a health benefit for my patients who ate a healthy diet, who got in those 6 to 8 or even 10 servings of fruits and vegetables each and every day. By the way, that's where you get your antioxidants from your food. But now that I've studied the medical literature, I also realize that my patients who take high-quality, complete and balanced nutritional supplements provide cellular nutrition. They have a health benefit. It optimizes our body's natural antioxidant defense system. It optimizes our natural immune system. The immune systems are great protector. And it also optimizes our body's natural repair system. You see, our body has a tremendous ability to heal itself. And over time, I'll educate you in the medical literature that shows how providing cellular nutrition can actually help the body heal. Even if you've already lost your health, it gives you the best chance to try to take back control of your health. So let me tell you one of the problems I had to deal with. As a physician, I was taught in medical school all you needed were RDA levels of nutrition. What is it? That's called the recommended dietary allowance, now called RDIs sometimes. But when I wrote my first book, I looked at this and I looked at where did RDAs, how did we find them? How did we discover them? Well, RDAs were developed in the late 1930s and early 1940s, especially during the wartime with our soldiers. And it was the minimal amount that was required to avoid what we called acute deficiency diseases, like scurvy, rickets, and pellagra. In the 1950s, it was embellished to be that amount that is required for normal growth and development. Well, this is what we base everything. The government makes us label everything according to RDA. So when you see and you look in the medical literature, you begin to realize very quickly RDAs have absolutely nothing to do with chronic degenerative diseases. Just an example in point. If you look at the RDA of vitamin E, the RDA is 30 IUs. Well, you don't even begin to see a health benefit in our medical literature till you get over 100 IU. And that improves and seems to get better and better, at least over 300 IUs. Well, go out and eat 300 IUs of vitamin E. You only need to get in 30 heads of spinach or 27 pounds of butter or 5 pounds of wheat germ each and every day. And then you can go to vitamin C. The RDA is 60 milligrams. Well, you look at the medical literature, you don't begin to see a health benefit until you get over 1,000 milligrams. And that's folic acid. I mean, that is just ascorbic acid. We've got ascorbates that are much stronger now in the Ariix optimals. But the point is that go out and eat 1,000, 1,500 milligrams of vitamin C. You only need to get in 80 avocados or 18 large oranges. What became very evident to me, there's no way you can eat this amount. In other words, you must supplement a diet to obtain these optimal or advanced levels that have been shown to provide a health benefit. RDAs have absolutely nothing to do with chronic degenerative diseases. In fact, in the last year, there have been 3 major studies released that multiple vitamins have no health benefit. Now, I agree with that because a one-a-day multiple vitamin is based on RDA levels. You can't get what I recommend in 1 tablet or capsule a day. So that is something you have to understand, that we need to be taking and we need to be supplementing optimal or advanced levels. These are levels you can't obtain from your food. You can't eat enough. So this is key, and you have to understand it's because of oxidative stress, the number of free radicals. We live in an environment that is polluted, our air, food, and water. We're exposed to a tremendous amount of stress in our lives. We're over-medicated. So this is something that you need to understand. But here is a key of why I really like Synergy and I like the Ariix Optimals. Because, look at vitamin E is the greatest antioxidant within the cell membrane. Vitamin C is the best antioxidant within the plasma. Glutathione is the most potent intracellular antioxidant. Alpha-lipoic acid is both fat-soluble and water-soluble, very potent antioxidant. But you see, all these antioxidants need the so-called B cofactors to do their job effectively. They also need the so-called antioxidant minerals, selenium, manganese, copper, zinc, to do their job. But here's what people don't realize, is that all these antioxidants are working against different free radicals in different parts of the body. So when we study vitamin E, the most amazing thing to me is that over 90% of the studies that get in these optimal advanced levels do show a health benefit. But the thing is, vitamin E is just one nutrient. And actually, when you use, what people don't realize is vitamin C actually can replenish that vitamin E, so it can be used over and over and over again. Alpha-lipoic acid is another key antioxidant, but it not only replenishes that vitamin E, but also that intracellular glutathione. So what I'm trying to share with you is the fact that when you create synergy by taking everything together, like we do in the Ariix Optimals, 1 + 1 is not 2, it becomes 8, 10, 20, 30. Well, why is that important? Because you bring oxidative stress back under control. That's our goal. That's the health benefit. That's what you're trying to accomplish, because it's the root cause of these chronic degenerative diseases. Well, when I write my books, I have to write them generically. This is what my publishers want. But, you know, I try to set up standards for people to understand. And if you're new and you have not heard me speak before, what you find is when you get into nutritional medicine, I'm dealing with a totally unregulated market. You know, the FDA looks at nutritional supplements like they look at food. Now, they're trying to increase and improve the quality and the standards, but basically, most companies, most nutritional companies follow no manufacturing practices. Then there's those that follow what we call food-grade good manufacturing practices. And essentially, even though that's better, they only have to have about 30% in the tablet or capsule that they say is on the label. You want to go with a company that follows pharmaceutical-grade good manufacturing practices. Now, what does that mean? Well, they buy pharmaceutical raw products. They have to be pure. They can't be contaminated, filled with toxins. They have to be tested. Then they manufacture their products much like a pharmaceutical company manufactures their drugs. The other thing is you want them to meet what we call USP guidelines, or US Pharmacopoeia, which means that the quality and dissolution of their capsules or tablets is there. Otherwise, you have no guarantee that you can absorb the nutrients, because you don't know if your capsules or tablets are dissolving. But what I like is also a company that manufactures their products in an FDA-registered facility. Now, this is critical because this shows you and gives you the confidence that they maintain the standards. In fact, Ariix's facility even goes beyond that, because they're approved for over-the-counter drugs that they can actually manufacture. That's called OTC approval. Then Ariix also not only meets all of these qualities voluntarily, but then they submit their products to third-party testing, and that's so they're NSF certified. What that means is third-party take it and they actually document what Ariix is saying about the quality of their manufacturing and what's in their product is documented, and we can rely on it. That is why there's a 100% potency guarantee for the Ariix products. But I can only think of a handful of companies that have this quality of manufacturing. But there is one other thing that people don't really appreciate, and they need to, you know, I want my products to be complete and balanced, especially the cellular nutrition. And this is, I want them to have everything. And so when I looked at Ariix, I saw that they not only met my criteria for quality and completeness, but they exceeded them. I've never been so excited about a product. And I'll tell you, you just talk to some people, and if you've taken these products for any length of time or know people, you're starting to see some tremendous health benefits, even if they were on fairly good quality products before. I experience this almost every day now. People tell me how much better they feel taking the Ariix optimals. Well, why is that? Well, when you look at it, there are many nutrients in the Ariix optimals that aren't found in any other products that present this cellular nutrition. The first thing is they have the most potent grapeseed extract, 100 milligrams. This is wonderful because grapeseed extract is 50 times more potent than vitamin E, and it's 20 times more potent than vitamin C. It is an anti-allergen. It is an anti-inflammatory naturally. It literally crosses the blood-brain barrier and can get around and protect the tissues, the brain, the nerve, the eyes. Well, then we have resveratrol, 15 milligrams, which almost no other product that I know of as far as cellular nutrition has. It's very expensive. All of these are very expensive. Most companies won't put them in. But resveratrol has been shown as an anti-cancer agent. It's the thing that gives wine all of its great benefits, but this is a concentrate form. And another very expensive and very potent antioxidant is alpha-lipoic acid. I mentioned that earlier. Wonderful product. Rosemary extract, bromelain, and then olive leaf extract actually has some antiviral, antibacterial capabilities, and it is also a very potent antioxidant. But you know, Ariix didn't stop there. They put in a vegetable juice concentrate and a super plant. Now, let me explain. You know, when we study broccoli and carrots and tomatoes and different things like this, we know there are other nutrients in there that are very important to the body we haven't been able to identify. You know, yeah, we've got all the essential nutrients, everything that's been studied in the Ariix optimals. But Ariix went beyond this because what they've done is put in food concentrates, which have all these other supporting nutrients, and they put it in a concentrate form in both the vegetable juice concentrate and then the super plant blend. So we have all of these, and then we have other proprietary blends that make our products unsurpassed in the marketplace today. Well, why do I get excited about that? Because I know my patients are going to experience health benefits when they take this product. So Ariix's optimals, you know, they're like taking and consuming a superfood. You know, in other words, they contain so much in the way of these optimal levels. So we're providing all the essentials, essential nutrients at their optimal advanced levels. Now, those are the levels that have been shown to provide a health benefit in our medical literature. They contain the super plant and vegetable juice concentrate blends. So we're getting all those additional nutrients that aren't even, have not even been identified by the medical community, because we know the people who eat their fruits and vegetables and they have the highest levels of antioxidants have a 2 to 3-fold decreased risk of heart attacks, of strokes, of Alzheimer's, of Parkinson's, of Alzheimer's dementia, of macular degeneration. The list goes on and on. And so we know there's a health benefit that we find. Plus, when you take it all together, it has all the optimal levels of the minerals and the B cofactors. We're getting 2,000 IUs of vitamin D3, for example. We're getting folic acid, B6, B12, all of those nutrients. We get the minerals at their optimal levels. So you get the synergy, and you can bring oxidative stress back into control. So, like I said, what I am doing now for my patients, I not only recommend a healthy diet. You don't want to be supplementing a poor diet, but a modest, consistent exercise program and cellular nutrition. And of course, my patients, I'm recommending Ariix's optimals. So at the base, I want everybody to be taking Ariix's optimals, no matter if they have good health, bad health, or whatever. It's the basis of what I do in nutritional medicine. Now, many patients come into me who have already lost their health. They might have rheumatoid arthritis. They might have lupus. They might have heart disease, cancer. Well, these people actually have been shown in the medical literature they have more oxidative stress than even someone, or free radical production, even than those who are in good health. So that's where I add my enhancers, like Phenale or BioPro Q, or I might recommend a detox and use Restorex, MOA, our juice, you are loaded with antioxidants. So when I'm trying to bring oxidative stress back under control, I'll add enhancers to cellular nutrition. I sure love omega Q. I love all those, and we're going to talk about those in the future. But tonight, I just wanted to focus on Ariix's optimals. So here's the key thing. You've got to remember that the problem is not a nutritional deficiency. The problem is oxidative stress. So when I recommend Ariix's optimals, I don't need to figure out, most people in nutritional medicine, they're trying to figure out what you need a little more of or a little less of. So we'll do a hair sample, blood testing, muscle testing, urine testing, iridology, anything to figure out, well, you need this, you need that, you're deficient in this. See, when you take everything, and it takes 6 months to build this up, but you're going to replenish any deficiency within 6 months, and you're going to bring all the other supporting nutrients up to their optimal levels. That's the key. I don't have to do all that testing. I just recommend the Ariix optimals. I don't want my patients to be nutritional nuts. Yeah, I want them to eat a healthy diet. I want them to exercise, but I want them to be taking cellular nutrition through taking Ariix optimals, and then go on and live life. That's what it's all about, because you got to remember, balance is the key. You want to have more antioxidants and their supporting nutrients available than the free radicals you produce. The focus and the goal of nutritional medicine is to bring oxidative stress back under control. So that's what's key. And that is the really thing that I want you to understand. So this is a lifestyle. This is not something you take for, 3 months, and then you say, well, I'm feeling good, that's great, now I can quit. It's like someone who says, I'm going to start to exercise, and they do tremendous workouts, and they work for 3-4 months, and they say, now I'm in excellent shape, I'm going to quit. I don't have to do this for the rest of my life. Or I just had breakfast, therefore I've nourished my body, I don't need any more nourishment. You see, our body uses these nutrients. You're providing all these nutrients the body needs. And it's a daily lifestyle you need to understand, and that's key, and that's what's very important. So just to end, I just want you to be aware of the fact that I do have a website. If you go to healthconcepts.int.com and just /Ariix, I give a 30% discount, not only for my 12-week basic Healthy for Life program, which is my program, my behavioral lifestyle program, but also what I have is my online medical practice, and you can join that, and I actually share my specific Ariix recommendations for over 100 different chronic degenerative diseases. Now, this isn't in any textbook. This is just what I've learned over the years, and I just share it with people. What you see, you can actually have the ability to share that in the form of a consult. So check it out. Really, if you have not started, or you're not taking your Ariix optimals, or if you've got them and you're not consistent, think about it. It's such an easy lifestyle to do, and once you get into it, you start to realize the health benefits that are there. And that is key. So I'm going to turn it back to you, Rick, to close, and we'll let you close this meeting.